start us off?
Hi, I'm Mariah.
I'm Jada.
I'm Maura.
My name's Kylie, and we're going to be covering the UCLA schizophrenia medication study from the 1980s. So the first question was, what was the aim of the study? What knowledge was learned from the study? According to PubMed, the study is called Developmental Processes in Schizophrenic Disorders, and it began in 1983 at UCLA under Keith and Michael. Its aim was to reset...
Just keep going.
Okay. Its aim was to follow recent onset schizophrenia patients within their first psychotic break in the last 2 years, treat them initially with an antipsychotic medication, and then in certain phases withdraw the stabilizing medication or go through placebo phases to study relapse. What precedes relapse, what environmental, physiological concerns there are, psychological predictors that exist, and whether patients might safely remain off the meds.
I also found on some archives on PubMed that the study was to look deeper into the early years of schizophrenia, what it looks like in its early developmental years, and how to recognize the people that were suffering from medication withdrawal.
So a little specific information I found of the researcher. Sorry, guys.
Just keep going.
Michael claimed that prolonged use of antipsychotic drugs can cause an irreversible condition in which patients have involuntary tremors. Patients were told that they would be offered high-quality treatment, but they were not informed on how bad their relapses could be.
Researchers learned more about symptoms which are early signs of relapse. The study advances our knowledge of the onset and course of psychotic episodes.
So I said that the knowledge that was learned from this study was when people are taking off their medication, they have severe adverse effects that impact their mental health and their well-being. Did anybody else find anything like similar or different?
Yeah.
Mm-hmm.
Yeah, and this study was obviously deemed unethical.
Okay. Yeah. Okay. Concerning the 5 human rights of self-determination, privacy, and dignity, anonymity, and confidentiality, fair treatment, and protection from discomfort and harm. I said that protection from discomfort and harm was violated in this study.
I agree.
As stated in an article, the true protection for persons with severe mental disabilities by the Journal of Law and Health. It goes into the details of how it violates protections that should have been put into place. Quote, testimony also revealed that the informed consent process was performed between the subject and investigator without any special safeguards, such as having the subject educator or advocate present. And the participant that I'm focused on who gave this testimony is Mr. Aller, and he was a college student who was stabilized on Prolixin and then asked to stop, which caused psychotic symptoms to come back in full. And his parents reached out to the researchers, they didn't do anything. And his father ultimately had to get involved to get his medication reinstated after months. So that was just like the main one that I saw in that.
To add on to that, I would say dignity was also violated because patients like that were asked to just abruptly stop their medications, they ended up spiraling really bad, and they didn't put them back on medications or do anything to help, they just observed. So
I feel like they should have decreased the amount instead of going like straight to the point of like withdrawing like the whole thing. Now they're going crazy.
Yep.
I also said that self-determination was violated as the consent forms did not adequately disclose how serious the relapse risks might be. The families and patients say that severe relapses, including suicidality, hallucinations, etc., were not spelled out full in writing. And some patients may have been too ill or cognitively impaired by schizophrenia to fully understand the risks of this study.
I agree. I found one of the other subjects was suicidal, and she expressed her concerns multiple times to staff members who were part of this study, and they didn't do anything. And another one of the participants ultimately had a relapse that was so bad she was institutionalized, where she still remains as of 1995 when this article was written. So we are not sure if she is still institutionalized or not.
Okay, the next topic is what are ethical principles at stake? So like autonomy, justice, beneficence, and non-maleficence. Some ethical principles that were at stake during this study, according to the ethical concerns of the schizophrenia research. I put non-maleficence. I said that researchers withheld antipsychotic medications from schizophrenic patients to see how the disease developed left untreated. But this did more harm to the patients, which was both predictable and avoidable. You can't just like take somebody's medication away with, like Maura said, without weaning them off of it or slowly decreasing the doses. So yeah, this put patients at risk for a dangerous relapse and possibly made them danger to themselves and others.
Yeah, especially suicide.
I put that non-maleficence was at stake here largely because the researchers were not avoiding or minimizing harm to these participants, especially the one that relapsed and then was institutionalized. They really, they didn't care to do anything to protect these patients or dismiss them or do anything like that, get counselors involved. They didn't do anything that could stop the harm that they were causing them. And Mr. Aller was being kept from being put back on his medication, and that is not being active in the promotion of the well-being of this participant.
Right, I also said autonomy was one that was at risk here. Because of deficient informed consent, patients and families were not told in writing the full extent of the risks. And schizophrenia patients may have had impaired decision-making, like I said before. I also said justice was one, as the study used a vulnerable population who may have had fewer resources or less of a capacity to fully negotiate or challenge their participation in the study just because of that schizophrenia.
Yep, definitely could have been taken advantage of.
Yes. Yeah, I agree.
What nursing code of ethics provisions highlight the nurse's obligations in this study? So I went on to the American Nurses Association and read through the code of ethics for them, and I found that patient-centered care, the nurses in the study should have been more involved with having resources for those who were having adverse reactions, like I had said before, kind of to help them be reoriented on their medication or dismissed from the study altogether. They should have been advocating if they were hearing that somebody was having suicidal thoughts. They should have advocated for any type of intervention,
100%.
or advocated for this patient to be dismissed altogether as well. And then I think that one ties in with the social justice ethics code. That should have been involved just to advocate for this group in order to stop the health disparities.
I picked provision 1 and 3, the human dignity must be respected, nurses must speak for patients who are at risk, and also there is safety and patients' rights protection. Nurses should step in when research endangers patients. The nurses who participated in this trial had an ethical duty to challenge and produce procedures, support informed consent, and shield patients from damage that was reasonably foreseeable.
Right, I agree with all of those. I also said commitment to the patients. The nurses had an obligation to ensure that their patients understood what was being done to them, the risks and benefits, different alternatives that could have been taken, and to freely choose and act as advocates when consent forms or discussions are inadequate. I also had said justice for this one, just to ensure fair treatment, especially of vulnerable persons, to ensure that their voices and or families are heard with no exploitation. And that kind of ties in with the advocacy that Jada was.
Especially since we're like the last say of like anything. Nurses should do like advocate for their patients way more, since we can be in trouble for endangering our patients, making sure they're not safe.
We're more involved.
Yeah. And we know our patients more than like other healthcare workers, so it's like, is this right for this patient? Is it safe for this patient? Is there concerns that you might have, instead of just not being caring?
I agree. That ties right into provision for like nurses having an authority over their own nursing practice, and they're responsible and accountable to make sure that they're preventing illness and providing optimal care, and also educating their patients as well. So.
Okay.
How could
Sorry, no, you go ahead.
How could the study be altered? What should be implemented to make the study more ethical? I said with complete informed consent, using medication tampering, provide precautions such as prompting re-medication if symptoms appear. Patients, advocates, and independent ethics reviews should be included, and prioritizing open and honest communication about rights and risk is essential.
Yeah, I agree with that 100%. I had also said stronger, clear, informed consent. It should clearly distinguish between treatment versus research aims. I had also said maybe a potential capacity assessment, since schizophrenia patients can have impaired understanding, involving maybe legal authorized representatives or guardians where needed could be something that might help with that. I'd also said having more rigorous oversight or monitoring, like doing frequent check-ins, low threshold for reinstating medication, clear criteria for clinical override, so none of these like super negative results were happening. Yeah.
I found on the ethical concerns in schizophrenia research by Wilson S. from 2005. It was more about like looking forward and how we can overcome that. And he said a lot of the same things, like giving full informed consent, let them know, like the participants and their families, that medication will be withheld, and like what they can expect to happen to them, so then that way they can make an informed decision about whether they really want to participate or not. I also thought that it should be maybe in a more controlled environment, with family involved or counselors being more involved, because I remember seeing these people, one of them was a college student, and they just kind of were like sent back to keep doing everything normally, and that could have caused like harm to other people around them as well, depending on the way that they reacted to being taken off their medication. And I also think that researchers could have studied the natural relapses by doing a more longitudinal study approach, and see what they could do to help improve the relapse rates, opposed to deliberately imposing a relapse on the participants.
Okay, and then for our last topic, is there ever a time when the knowledge gained from an unethical study outweighs the duty to treat subjects ethically? Me personally, I put no. Patient safety and health come before anything. I'm sure there's many different safe and effective ways to do patient research without causing them severe harm. And also, like, healthcare professionals are trusted to find solutions to problems without risking patient safety and health.
I even said no. Even if a study could lead to important discoveries, it's never okay to harm people or ignore their rights to get that knowledge. Ethics are what keep research safe and fair. If we cross that line, we risk hurting people, losing trust, and getting results that might not even be reliable.
Yeah, I agree. I also said no. In many ethical frameworks, the duty to treat subjects ethically is a supreme constraint. Knowledge doesn't override rights. In practice, there is tension. The among the three of us at least, was that no, there should never be a situation where you knowingly violate core rights like informed consent, protection from serious harm, etc., just because knowledge is desirable.
I said that I think it depends on the severity of the study. I think there's very different ways that ethics have limited our ability to get true and real data, and there are also studies that were unethical, like this study that were not, like, the data wasn't super reliable, so I think that it really just depends. Like, ethical studies can have altered data and unethical ones can as well, but I think that there are ways that studies can be done unethically to an extent in order to gain knowledge about humans and medical knowledge as well. I think there could still be parameters in place that would make unethical studies more ethical. I also believe that if there are consenting adults involved and they know that they could suffer trauma or adverse outcomes and still want to participate, then that's up to them. Like, there are some people and like they donate their bodies to medical research when they die, such as those cadaver bodies, and I think that even alive humans, they can still donate themselves to studies if they so want to. Because some people are just super interested in the progression of human science that they're willing to sacrifice themselves for the greater good. And I think if they decide at any time during the study that they don't want to participate, then they can be released. But I also want to add that if there were to be such studies done, that they must be looking for specific outcomes, because we know from the studies that were done in Nazi concentration camps in the 1940s, all of the data was deemed useless, pretty much, and was pseudoscience, showing that studies that are extremely detrimental yield absolutely no valuable data in the end. Yeah, that's what I have for that.
That's all the questions we're gonna answer. Thanks for watching our video.
Yeah,
Yeah,
thank you.
thanks.
Bye.